Hi everyone, my name is Yi. I'm your host for Occupational Medicine Pearls podcast. Today I would like to cover non-ionizing radiation. So today's episode, and there will be a few more coming, they are centered around different type of non-ionizing radiation. The audience is aimed at occupational health professionals, and context is mostly for Australian standard, but you can apply principles everywhere. So the first thing I want to start is that UV or ultraviolet radiation. So there are three types as we know it: UVA, B, and C, depending on the wavelength. So the UVA is the longest, between 300 to 400, I think, and UVB is between 280 to about 315 nanometer. UVC is the shortest with 100 to 280 nanometer. UVA can go into deep dermal penetration and can cause photoaging, cataract to the eye, and contributes to melanoma development. UVB is the one that causes sunburn and contribute to all type of skin cancer, but it is useful for vitamin D synthesis. UVC is that most dangerous and most biologically damaging, and hence we use in killing germs. Usually it is absorbed entirely by atmosphere, provided that atmosphere is present above our head. Where do we get them? Outdoor work is the most likely source and the highest dose you could say, solar radiation, and that is important where you are at. So if you are closer to latitude closer to equator, UVB increase. And Australia has the world's highest ambient UV level. From occupationally, we can see that in the first thing that come into my mind is welders, so arc welding or any welding type that emit a lot of light. And we see that in the UVC lamps, in the healthcare or food processing, tanning beds we don't have here anymore, phototherapy units, that's for the UV treatment for the skin condition, and also curing lamp in the dental printing industry, and adhesive. These small handheld UV torches that mold your dental treatment, so they are important sources. At-risk occupation, outdoor workers would be the first come into my mind. So that include farmers, agricultural workers, if you are fisher, construction workers, road workers, landscaper, everyone. Welders and arc welding, healthcare workers who are dealing with the UV light therapies. Lab workers could be involved if they handle the UV radiation. But generally, outdoor workers would have 5 to 10 times more UV dose than indoor workers in Australia. How do we set the standard? It's probably a lot to remember doses of that, but Apenza, who sets the limit, said that 30 joule per meter square effective radiant exposure per 8-hour working days for the work limit. So what sort of health effects that UV cause? On the skin, we'll think about skin and eye predominantly. And skin, it can cause photoaging, precancerous lesion like actinic keratosis, or just normal sunburn. It increases the risk of skin cancer such as squamous cell cancer, basal cell cancer, and cutaneous melanoma. With our eye, it can cause just condition like cataract, pterygium, and also for the welders, they call welder's eye or photokeratitis. It can also cause photoconjunctivitis as well. With the photosensitivity reaction point of view, some people may have immune-mediated reaction called photoallergic reaction, and also there is phototoxic. Some medication such as doxycycline or amiodarone can cause phototoxic reaction, so you broke out in a rash when you are spending time outdoors, and that can happen even with a short duration. There are also certain plants that can cause phytophotodermatitis, so parsley, celery, fig, and rue. Now we know about the health effects and occupation, and we mentioned about cancer, how strong the evidence is. So the IARC classification is that group 1 carcinogen. So in the non-ionizing radiation, this is the most dangerous stuff. And that includes all the outdoor workers as well as welders predominant. How do we monitor them? We don't generally need to monitor the UV dose unless there is a specific research or need to investigate, so it's not something routinely performed. But you could be asked or shown a photo of a portable or handheld UV dose meter in exam and asking about what that is. And that is usually similar to the LOX meter, but designed to detect the UV dosage. You can also wear personal UV dosimetry, but again, we don't use that routinely. The good way in Australia is that the Bureau of Meteorology released the UV index, so that can be used as a rough guide to see the level of the UV outside. And we can also do regular skin check, which is also a form of control, but they are used for monitoring the exposure. How do we control them? And that seems quite simple in terms of when we are answering. The first thing that came into your mind probably be sunscreen with SPF at least 50. That's right, but it is only the lower level control. So elimination or substitution is that can we do this work indoors, or can we assemble parts indoors and move outside to avoid any outdoor work if we can, and that is, or to do the work at the time with the minimum UV exposure, so avoiding the time between 10 about 3 p.m.-ish. That's important, and rotate the job so that people are not exposing all the time. Now that's I should not mention rotate the job because we're talking about elimination and substitution. Regarding welding, can we avoid particular type of arc welding? So when we're looking at engineering, have a shaded structure so that let people work under the protection. If we develop welding screen, curtain, and these modern welding shields has UV block so that it automatically kick in as soon as the light is in front of your eyes. Administratively, we can have SunSmart policy and skin protection training, and that's where job rotation come in. And considering the amount of UV light, you can allow people to work in certain time of the day. From PPE point of view, think about starting with the clothing. So you think about wearing a hat, sunnies, goggles, long sleeve clothing, trousers. They need to have a certain standard. They need to meet the UPF protection factor at least 50 and above, and that need to be collar, long sleeve, and the hat has to be broad brim hat, and if on top of that the eye protection is also UV absorbing safety goggles, so it has to be very specific. For the welders, they need to have specific welding lens that protect a shaded filter. For the sunscreen, we have to consider SPF 50 plus at least. It has to be broad spectrum, and if people are sweating, they need to be, or if they're going to work near the waters, it has to be water resistant. The principle here is that sunscreen would only last very short duration, so you need to reapply every 2 hours. And that is only for, in addition to the clothing, it can't be used as a single control. Well, that's a brief summary about the UV radiation relevant to occupational medicine, and I will continue to other non-ionizing radiation in the following episode. Chat to you later.